It's part of the Convatec education program. We wanted to have something that we could use in our practice, literally use in our exam room when we are educating patients. We got together an international panel of experts who are in urology and continence care. And, we sat around through a Delphi method trying to figure out what do we want to do as far as what principles are important.
It was a pleasure to be part of the team that could come together and develop some best practice principles that can be used not only for our patients to help ensure that we're supporting conversation, advocating for them and engaging in an open dialogue to help with their learning experience, but also to help staff when they're trying to train to be able to know what they need to include as part of their teaching process.
When we talk about bladder care, I believe one of the most important aspects that we have to bring to this big question, educate our patients, educate caregivers.
So there's 3 components to them. We start with pre-consultation. What is done with that patient consultation, and then what is the ongoing support. So let's start with pre-consultation. We developed a checklist. We wanted to have a checklist that was as succinct as possible, that had the key points. What we hope is that this checklist will aid that nurse in educating the patient when they start to teach them how to catheterize. I'm hopeful that that checklist will be literally sitting next to that nurse in the exam room who's with that patient, that she goes step by step on what she needs to tell them, what's important as far as to make sure that catheterization is successful, and also to make sure the patient accepts it. What is developed as part of these principles is an actually personalized video, and this is brand agnostic, that really they can see when they leave. They don't remember everything. If maybe that checklist helps, but they may forget. What did she say as far as how many times to catheterize? What did she say about how I put it in?
Of course, as many of us, when you are in an office of a doctor, you hear like 20% of the information that you got from the doctor.
We decided to have an FAQ, so frequently asked questions. Now, we came up with 10 at the top, but then we have like 70 questions that they may have. And I think that this is really, really important as far as understanding, what if this happens? What if was this? So that they know, yeah, that can happen and this is what you can do.
I think it's nice that the tool has multiple different aspects of it. So it has parts that are patient-centric to try and gain information about that patient before they come to you, but also checklists for healthcare professionals that we can then make sure that we're capturing everything. Because when you've got a lot of information to tell them in a short space of time, you want to make sure that you've covered everything.
Really, I think as a conscientious manufacturer and in line with our commitment to forever caring, we do need to provide that enhanced level of support, and I think that's what our patient support program will hopefully achieve.